Welcome to Pediatric Case Review. Today's lecture provides a comprehensive clinical review of Ellis Van Creveld Syndrome, a rare genetic disorder that every pediatrician and geneticist should recognize. This presentation is designed for practicing healthcare professionals seeking intermediate-level clinical knowledge about diagnosis and management. A newborn presents with shortened forearms and legs, along with an extra finger on both hands. What is the most characteristic skeletal finding in this condition? Option A, rhizomelic shortening. Option B, mesomelic shortening. Option C, acromelic shortening. Or Option D, proportionate dwarfism. The correct answer is C, acromelic shortening. Ellis Van Creveld Syndrome characteristically affects the most distal limb segments, including hands, feet, forearms, and lower legs. This creates disproportionate short stature with a progressive pattern where distal segments are more severely affected than proximal segments, distinguishing it from other skeletal dysplasias. A 6-month-old infant had extra digits noted at birth, whereas polydactyly most commonly located in Ellis Van Creveld Syndrome. Option A, preaxial hands only. Option B, postaxial hands only. Option C, postaxial hands and feet. Or Option D, preaxial feet only. The correct answer is C, postaxial hands and feet. Postaxial polydactyly affects 100% of cases involving the hands and is typically bilateral. The feet are affected less commonly, in approximately 10 to 20% of cases. The extra digit may be fully formed or rudimentary, representing a hallmark diagnostic feature. A neonate with short limbs has a heart murmur detected on examination. What cardiac defect occurs in 50 to 60% of Ellis Van Creveld Syndrome cases? Option A, ventricular septal defect. Option B, atrial septal defect. Option C, patent ductus arteriosus. Or Option D, tetralogy of Fallot. The correct answer is B, atrial septal defect. This is the most common cardiac defect in Ellis Van Creveld Syndrome, occurring in 50 to 60% of cases. The defects are often large primum-type atrial septal defects, and some patients may have a common atrium. Cardiac defects represent the major cause of mortality. A 2-year-old child with Ellis Van Creveld Syndrome has multiple dental abnormalities noted during examination. What oral finding is most characteristic of this condition? Option A, delayed tooth eruption only. Option B, natal teeth. Option C, multiple frenula and tooth abnormalities. Or Option D, cleft palate. The correct answer is C, multiple frenula and tooth abnormalities. Ellis Van Creveld Syndrome characteristically presents with partial upper lip to gum fusion creating multiple frenula. Natal or neonatal teeth are common. Additional findings include hypoplastic teeth, delayed eruption, and conical tooth shape, making this a distinctive diagnostic feature. An infant with Ellis Van Creveld Syndrome is examined and shows abnormal fingernails and toenails. What nail abnormality is most common in this condition? Option A, nail pitting. Option B, dysplastic, hypoplastic nails. Option C, onycholysis. Or Option D, koilonychia. The correct answer is B, dysplastic, hypoplastic nails. The nails are characteristically small, thin, and poorly formed, affecting fingers more severely than toes. This represents the ectodermal dysplasia component of Ellis Van Creveld Syndrome. The nail abnormalities may improve slightly with age, but typically persist throughout life. A newborn with Ellis Van Creveld Syndrome presents with respiratory distress and a narrow chest on examination. What thoracic finding best explains the respiratory complications in this condition? Option A, long, wide ribs. Option B, short ribs with narrow thorax. Option C, pectus excavatum. Or Option D, scoliosis. The correct answer is B, short ribs with narrow thorax. The thoracic cage is abnormally small due to shortened ribs, which restricts lung development and expansion. This causes respiratory insufficiency in neonates, which can be life-threatening. Many affected infants require ventilatory support during the neonatal period. A child with suspected Ellis Van Creveld Syndrome undergoes anthropometric measurements. What measurement ratio is most abnormal in this condition? Option A, head-to-trunk ratio. Option B, upper to lower segment ratio. Option C, distal to proximal limb ratio. Or Option D, sitting to standing height ratio. The correct answer is C, distal to proximal limb ratio. The forearms and lower legs are disproportionately short compared to upper arms and thighs, with hands and feet most severely affected. This progressive acromelic pattern creates a characteristic clinical appearance and is useful for establishing the diagnosis alongside other features. A 5-year-old child with Ellis Van Creveld Syndrome is being tracked on growth charts. What adult height range is most typical for affected individuals? Option A, 150 to 170 centimeters. Option B, 130 to 150 centimeters. Option C, 106 to 152 centimeters. Or option D, below 100 centimeters. The correct answer is C, 106 to 152 centimeters, equivalent to approximately 3.5 to 5 feet. This represents significant short stature with wide variability between patients. Growth velocity is relatively normal, and final adult height depends on the severity of limb involvement and skeletal abnormalities. An infant with Ellis Van Creveld Syndrome has a fixed split-second heart sound on auscultation. What echocardiographic finding is most likely? Option A, small muscular ventricular septal defect. Option B, large primum atrial septal defect. Option C, bicuspid aortic valve. Or option D, mild pulmonary stenosis. The correct answer is B, large primum atrial septal defect. Fixed split-second heart sound is classic for atrial septal defect. A systolic ejection murmur may also be heard. Primum defects in Ellis Van Creveld syndrome are often large and can progress to Eisenmenger syndrome if left untreated, requiring early intervention. A child with Ellis Van Creveld syndrome is evaluated for joint mobility and range of motion. What joint finding is characteristically present? Option A, joint hypermobility. Option B, knee and elbow fusion. Option C, limited extension with genu valgum or knock knee. Or option D, joint contractures. The correct answer is C, limited extension with genu valgum. Knock knee deformity is common in Ellis Van Creveld syndrome. Limited elbow extension is also frequently observed. Hip dysplasia may occur in some patients. These joint abnormalities tend to be progressive with growth and may require orthopedic intervention. A family of a child with Ellis Van Creveld syndrome asks about expected intellectual development. What is the typical cognitive outcome? Option A, severe intellectual disability. Option B, mild cognitive impairment. Option C, normal intelligence. Or option D, progressive cognitive decline. The correct answer is C, normal intelligence. Neurological development is typically normal in Ellis Van Creveld syndrome as there is no primary brain involvement. Educational potential is not limited by the syndrome itself. This is an important counseling point for families, emphasizing that affected children can achieve normal academic success. A neonate with Ellis Van Creveld syndrome is evaluated for multiple congenital anomalies. What genitourinary anomaly may be present? Option A, hypospadias and cryptorchidism. Option B, renal agenesis. Option C, vesicoureteral reflux. Or option D, neurogenic bladder. The correct answer is A, hypospadias and cryptorchidism. These genitourinary anomalies occur in some male patients as part of the syndrome's variable expression. Affected males require urological evaluation. Surgical correction may be needed for hypospadias and orchiopexy for cryptorchidism following standard pediatric urological protocols. Parents of a child with Ellis Van Creveld syndrome request genetic counseling for future pregnancies. What is the inheritance pattern of this condition? Option A, autosomal dominant. Option B, autosomal recessive. Option C, X-linked recessive. Or option D, mitochondrial. The correct answer is B, autosomal recessive. Ellis Van Creveld syndrome results from mutations in the EVC or EVC2 genes. Both parents are typically asymptomatic carriers. The recurrence risk is 25% for each pregnancy. The condition has higher prevalence in Amish communities due to founder effect. A researcher is studying EVC protein function in skeletal development. What cellular pathway do EVC proteins regulate? Option A, MAPK signaling. Option B, hedgehog signaling. Option C, WNT signaling. Or option D, TGF-beta signaling. The correct answer is B, hedgehog signaling. EVC proteins localize to the primary cilium and are critical for hedgehog pathway signal transduction. This pathway is essential for normal skeletal development. Disruption of hedgehog signaling due to EVC mutations causes the characteristic skeletal and cardiac features of the syndrome. A skeletal survey is ordered for a child with suspected Ellis Van Creveld syndrome. What radiographic finding is most characteristic? Option A, proximal femoral focal deficiency. Option B, fusion of hamate and capitate bones. Option C, Wormian bones in skull. Or option D, platyspondyly. The correct answer is B, fusion of hamate and capitate bones. This finding is pathognomonic for Ellis Van Creveld syndrome. Additional radiographic features include an extra ossification center in the proximal tibia, short tubular bones with cone-shaped epiphyses, short ribs, and horizontal acetabular roof. These findings confirm the diagnosis. A newborn is diagnosed with Ellis Van Creveld syndrome. What initial cardiac investigation is mandatory for all affected individuals? Option A, exercise stress test. Option B, echocardiography. Option C, cardiac MRI. Or option D, Holter monitoring. The correct answer is B, echocardiography. This is essential for all patients at the time of diagnosis to screen for atrial septal defect, common atrium, and other cardiac defects. Results guide management decisions regarding surgical intervention. Echocardiography should be repeated if a murmur develops later in childhood. Parents of a clinically suspected Ellis Van Creveld Syndrome case desire confirmatory genetic testing. What test best confirms the diagnosis? Option A, karyotype analysis. Option B, FISH testing. Option C, EVC and EVC2 gene sequencing. Or option D, skeletal survey alone. The correct answer is C, EVC and EVC2 gene sequencing. This identifies specific mutations and confirms the diagnosis at the molecular level. It enables carrier testing for family members and prenatal diagnosis for future pregnancies. The detection rate is approximately 90% when both genes are fully sequenced. A carrier couple planning a pregnancy seeks genetic counseling. What prenatal finding on ultrasound suggests Ellis Van Creveld Syndrome? Option A, increased nuchal translucency only. Option B, short long bones, polydactyly, and cardiac defect. Option C, elevated AFP. Or option D, choroid plexus cysts. The correct answer is B, short long bones, polydactyly, and cardiac defect on ultrasound. These features become visible on detailed ultrasound at 18 to 20 weeks gestation. A narrow thorax may also be apparent. Genetic testing via amniocentesis or chorionic villus sampling can confirm the diagnosis, enabling informed family planning decisions. A neonate with Ellis Van Creveld Syndrome presents with respiratory distress secondary to narrow thorax. What is the priority management? Option A, immediate cardiac surgery. Option B, respiratory support and monitoring. Option C, limb lengthening surgery. Or option D, growth hormone therapy. The correct answer is B, respiratory support and monitoring. Neonates may require mechanical ventilation because the thoracic cage restricts lung expansion. Close monitoring in the neonatal intensive care unit is essential. Adequate respiratory support significantly improves survival rates. Cardiac issues are addressed once the infant is stabilized. A 2-year-old with Ellis Van Creveld Syndrome has a large primum atrial septal defect with failure to thrive. What is the indication for surgical repair? Option A, all atrial septal defects require immediate surgery. Option B, significant shunt, failure to thrive, and frequent infections. Option C, wait until adolescence. Or option D, surgery is contraindicated in this syndrome. The correct answer is B, significant shunt, failure to thrive, and frequent infections. Surgery is needed for large atrial septal defects causing complications. Optimal timing is typically between 2 and 4 years of age. Surgical repair significantly improves survival and quality of life. The procedure requires cardiopulmonary bypass and experienced cardiac surgeons. A child with Ellis Van Creveld Syndrome develops progressive genu valgum affecting mobility. What orthopedic intervention may be needed? Option A, limb lengthening procedures. Option B, corrective osteotomy. Option C, joint replacement. Or option D, amputation. The correct answer is B, corrective osteotomy. This surgical procedure addresses progressive angular deformities like genu valgum, improving function and mobility. Limb lengthening procedures are controversial with limited benefit in this syndrome. Physical therapy serves as an important adjunct to surgical intervention for maintaining range of motion and strength. A 5-year-old with Ellis Van Creveld Syndrome needs dental care for multiple abnormalities. What dental intervention is commonly needed? Option A, no treatment is necessary. Option B, frenectomy and orthodontic care. Option C, full mouth extraction. Or option D, dental implants. The correct answer is B, frenectomy and orthodontic care. Multiple frenula may require surgical release to improve oral function and appearance. Orthodontic treatment addresses tooth spacing and alignment issues. Restorative dental care may be needed for dysplastic teeth. Regular dental monitoring is essential throughout childhood and adolescence. A parent asks about optimal timing for removal of the extra digit in their infant with Ellis Van Creveld Syndrome. When is polydactyly surgery typically performed? Option A, immediately after birth. Option B, 6 to 12 months of age. Option C, school age. Or option D, never remove extra digits. The correct answer is B, 6 to 12 months of age. This timing allows for safe anesthesia administration while performing surgery before significant hand use patterns develop. The procedure aims to preserve normal digit function. Fully formed extra digits may require ray resection, including metacarpal or metatarsal bones, for optimal functional outcome. A family asks about long-term care coordination for their child with Ellis Van Creveld Syndrome. Which specialists are essential for comprehensive care? Option A, only a pediatrician. Option B, cardiology, orthopedics, genetics, and dentistry. Option C, neurology and psychiatry. Or option D, endocrinology only. The correct answer is B, cardiology, orthopedics, genetics, and dentistry. Comprehensive care requires cardiac surveillance and intervention, orthopedic management of skeletal issues, genetic counseling for the family, and specialized dental care for oral manifestations. A coordinated multidisciplinary team approach optimizes outcomes and quality of life for affected individuals. An infant with Ellis Van Creveld Syndrome experiences recurrent respiratory infections. What factor most contributes to respiratory morbidity? Option A, primary immunodeficiency. Option B, restrictive lung disease from thoracic dysplasia. Option C, tracheomalacia. Or option D, pulmonary hypoplasia only.